Afternoon, everybody. Today, I'm going to walk you through the steps on how to establish CPAP on a patient that is experiencing congestive heart failure exacerbation or is in flash pulmonary edema. One of the first things we want to do is make sure that our patient is a candidate for CPAP. What we want to do is we want to make sure that the patient is conscious. They do have a respiratory drive. They may be close to failure, but they need to be able to maintain their own airway in order to be a candidate for CPAP. We want to make sure that there's no they have no major surgical history or lung removals or anything major along that line. We also want to just make sure that they can tolerate that kind of a mask. This is where you want to kind of talk to your patient and you want to just walk them through what you are going to do to them and reassure them that it's going to be okay. CPAP is a relatively routine procedure and that we see on the field nowadays. Medics will do it, EMTs can do it. Explain to the patient exactly what's going to happen. Explain that there's going to be a mask, it's going to cover their face, it's going to have large volumes of oxygen rushing in, and it may feel weird at first, it may feel actually worse at first, but there will be relief from it once the oxygen can get down to the lungs and kind of open up those alveoli and get that gas exchange to start happening. So again, talk to your patient, make sure they understand what's going on, what you're about to do, and just reassure them that they're going to be okay in your care, that kind of thing. So what we have, and depending on your service, you may have different types of CPAPs, but the ones that we carry around here are going to be the FlowSafe 2s. Very easy to use. They have a mask that affixes with clips. Very easy to get on and off. And they also have their own separate gauge for PEEP. And they can also have a built-in neb chamber that if we need to give a breathing treatment on top of administering CPAP, we can do that. So what we want to do is, first things first, is check our equipment, make sure that it is everything is here and is fully functional. These are kind of bulky masks, so they may get damaged in the bag. We just want to make sure that nothing's broken, nothing's missing, because if we don't have an adequate seal, CPAP will not be effective. It won't be able to work, right? So one of the first things I want to do is I want to unclip the blue clips at the bottom here. I'm going to take this mask, I'm going to throw it over our patient's head. These two white pieces up here are for the forehead. They'll affix to the forehead. You have your top piece right here. It goes to the bridge of your nose. The bottom shape is going to be almost like a cone, like a teardrop shape, right? So it's going to hang right down by your chin. And what we're looking for is a complete seal around the face, right? So once the mask is in place, we're going to clip it on. We're going to clip it on, and now we're going to cinch down our straps. So they're just Velcro straps. I'm going to get this tight. We don't want any oxygen to escape. We want to maintain a good seal. Now what we're going to do is we're going to connect our oxygen reservoir. On a live patient, we want to have this going already. We don't want to affix a mask onto a patient without oxygen running to it. And now for CHF exacerbation, we want to set this to about somewhere between 10 to 12 liters per minute. We want to maintain a PEEP around 5 to 10 centimeters of mercury per max. We want a T and a neb. We do want to drop that pressure down a little bit, or that flow down a little bit to about 8 to 10 to allow that medication to aerosol and get that good aerosol effect, so that way it can reach down to the lungs. For this purposes, we're just going to do straight CPAP. So we have our flow set to 12 liters per minute. Our PEEP is set to about 5. And now what we want to do is we want to check the seal. I want to make sure that there is no oxygen escaping on the side of the masks. And after this, I'm going to hook up the patient pack if they're not already on it. We're going to put them on SpO2. We're going to hook up the end tidal monitoring onto this as well. And we're going to consistently reassess our patient. Every couple of minutes, we want to reassess lung sounds. We want to reassess patient responsiveness. We want to get a good respiratory rate, see if the respiratory drive is improving, if they're decompensating more. Some things to consider: that if CPAP is on and the patient becomes unresponsive, we want to disconnect the CPAP and we want to start bagging at that point. But as long as the patient is maintaining their own airway, they are conscious, they're alert, they can maintain that CPAP all the way down to the hospital. And again, if we want to add medication to this, say this patient's in congestive heart failure, we want to give some nitroglycerin for it. With this mask, what we can do, we can easily hook it. We have our nitro spray, our nitro tab. We can lift this up, administer our medication, and then quickly, without wasting any time or oxygen, clip this back, and then we're good to go. Again, reassess your patient every couple of minutes. Make sure they're maintaining their airway still. Reassessing for lung sounds, and that's it. Thank you.